All right, welcome to The Explainer. Today we're going to take a look deep inside the human heart because the technology we use to see it is completely changing the game. We're moving way beyond just seeing a problem to actually understanding its real-world impact.
So why do we even need to look inside? What's the big deal? Well, the stakes, they honestly couldn't be any higher. I mean, just look at the numbers. According to the World Health Organization, ischemic heart disease is still the #1 cause of death globally. And it's not even close. And that's exactly why getting a much clearer picture of what's happening inside our arteries is so absolutely critical.
Okay, so for a long time, our best bet for a non-invasive look at the heart's arteries has been the cardiac CT scan. Think of it as our first real map of the territory. But a map can only tell you so much, right?
And don't get me wrong, a standard CT scan it's fantastic at showing us the physical structure. It's like getting a detailed diagram of the heart's plumbing. It'll show you, yep, there's a buildup of plaque here, and it's causing a narrowing in this pipe.
But here's the thing. That's where the anatomical picture stops, and a really crucial question pops up. Okay, great, we can see a blockage, but is it actually choking off the blood flow? I mean, how bad is it really?
And that question, that's what moves us beyond just looking at the blueprints, the anatomy, and into the world of function. How is this system actually working day to day?
To answer that, doctors need a measurement called fractional flow reserve, or FFR. Now, for the longest time, this was a pretty invasive procedure. They literally have to thread a special wire into your artery, and the whole point is to check for a big pressure drop after the blockage. If that value dips below 0.8, that's a huge red flag. It means that blockage is serious.
But now, and this is the cool part, we can do this with software, right from that original CT scan. Just think about squeezing a garden hose, right? The water pressure builds up behind your thumb and then it drops right after. This incredible software uses some really advanced fluid dynamics to basically model that exact effect in your arteries and calculate the pressure drop, all of it done non-invasively.
Okay, so now we know if a blockage is a real problem right now. But that's just one piece of the puzzle. What if we could look into the future a bit? What if we could predict which of these blockages are the most likely to cause a heart attack down the road?
I mean, that's the dream, right? The holy grail of preventative cardiology. And the key to it all is finding what are called vulnerable plaques. These are the real ticking time bombs inside the arteries. And what's just incredible is that the latest CT analysis can actually spot the warning signs. We're talking about things like the artery itself bulging outwards to make room for the plaque, or seeing a big, soft, fatty core that looks like it's ready to rupture, or even just seeing these little scattered bits of calcium. All of these are flashing red lights that tell doctors, hey, this one is unstable.
The story doesn't even stop inside the vessel wall. The disease actually spills out into the fat and tissue surrounding the artery. And that's because, at its very core, heart disease is an inflammatory disease. And we can see that inflammation on the scan. See, healthy fat around an artery has a really low density on a CT scan, shows up as a dark color. But when it gets inflamed, it actually gets denser. It starts to look different. And that change is a dead giveaway for inflammation. It's a key risk factor that doctors can spot, sometimes even before a big, nasty plaque is even formed.
So we can see the anatomy, we can see the function, we can see the future risk, and now we can also see the damage that's already been done. By watching how a contrast dye flows through the heart muscle itself, that's a technique called perfusion, we can spot areas of scarring, maybe from a silent heart attack you never even knew you had. Or we can find tissue that's just not getting enough blood.
Now, all of these new tricks, FFR, plaque analysis, inflammation, they're all incredibly powerful. But they have one thing in common. They all depend on how good that first picture is. And there's been a recent breakthrough that's changing the fundamental physics of how we get that picture. It's giving us a level of clarity that's just, wow.
It's called photon counting CT. So, your traditional CT detector, it's a two-step process. X-rays hit a crystal, the crystal makes light, and then a sensor measures the light. It's indirect. Photon counting, though, it's a direct conversion. The X-ray photon hits the detector and bam, it's immediately an electrical signal. It's way more efficient, way more precise, and it cuts out a ton of background noise.
And this is where that new tech really shines. If you have a lot of calcium in your arteries, or maybe a metal stent, conventional CTs, they struggle. The metal creates this blooming effect, this glare that just whites everything out. You can't see inside. But photon counting, It just cuts right through that noise. Doctors can get this crystal clear view of the actual opening inside the artery, even inside a stent. It's a total game changer. And really, this quote just sums up the whole paradigm shift perfectly. The idea of having only that anatomical exam has fallen away. We don't want just that anymore. We want functional exams. It's not just about a pretty picture anymore.
So, look how far we've come. We started by just asking one simple question. Is there a blockage? Now, from a single exam, we can answer a whole list of them. Does it limit flow? Is it dangerous? Is there any scarring? And can we see it all with perfect clarity? Yes, 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 and yes.
So, what's the big takeaway here? It's that we are moving toward a single, comprehensive scan. One non-invasive test that looks at everything: the structure, the function, the risk, the damage, the whole shebang. This is the future of truly personalized heart care.
And that evolution in technology leaves us with a really powerful final thought. As our imaging gets this detailed, as we get this good at predicting risk, are we finally on the verge of shifting from just treating heart attacks to actually preventing them altogether? Thank you for joining us for this explainer.